As we outline in our overview video, lupus, or systemic lupus erythematosus, or SLE for short, is an autoimmune disease that can affect a variety of different organs in the body. It is more common in women than men, and often can affect women in their childbearing years. Because of this, for women with lupus, it is important to know the role lupus plays in pregnancy. Lupus does not make pregnancy better or worse. Conversely, pregnancy does not have an effect on lupus. However, it is strongly recommended that your lupus is under good control for at least 6 months prior to becoming pregnant to reduce the risk of having a lupus flare during pregnancy. Before becoming pregnant, you should review the status of your lupus with your physician or rheumatologist. In particular, it is important to know your antibody profile. Certain antibodies associated with lupus can increase your risk for certain problems during pregnancy that may not be an issue otherwise. Some patients with lupus have what is called a positive antiphospholipid antibody. Normally, these antibodies may increase your risk for blood clots, but can also lead to early loss of pregnancy. For women who have had a miscarriage in early pregnancy, it may be worthwhile checking for this antibody, as there are treatments which can reduce the risk of this occurring. Other patients with lupus have what is called anti-Rho or AntiLa antibodies. Normally, these have no effect on lupus patients directly. However, they have the potential to affect the fetus in the uterus in one of two ways. Some babies will develop neonatal lupus, a type of lupus which is usually short-lived when they are born due to the transfer of the antibodies from the mother through the placenta. The most common finding is a rash. However, over a few months, these antibodies disappear and the lupus with it. These same antibodies can cause heart block, a condition which affects the electrical system of the baby's heart and how it beats. The fetus of women who have these antibodies can be carefully monitored during pregnancy, and if there is any sign of heart block, medication can be provided to try to limit its effect. Many women are concerned about taking medications during pregnancy. With lupus, it is always a balance between the risk of having a lupus flare off medication and the risk of the medication itself. It is important to discuss this with your doctor prior to pregnancy. However, broadly speaking, and if necessary, low-dose prednisone, antimalarials such as hydroxychloroquine and azathioprine are considered safe to use during pregnancy. Methotrexate, mycophenolate, and cyclophosphamide are considered unsafe and should be stopped in advance of becoming pregnant. For most women with lupus, a safe and healthy pregnancy is common and very achievable.